Morning, everyone. Gareth Presh, CEO, Global Social Prescribing Alliance, founder of the World Health Innovation Summit. Absolutely delighted to welcome you to the Global Social Prescribing Summit 2025. Whether you're joining us from a clinic, a university, a community centre, or a kitchen table, thank you. Extremely grateful that you're able to join this growing global movement. And this is how we transform and deliver the future of healthcare. In 2020, myself and James Sanderson really just set out to reimagine healthcare. Not a system that treats illness, but one that enables people to live well and thrive. We want to move the system from a sick care system to a health and well-being system that really delivers, I guess, wellness for all. With many of you here today, I'm just so pleased so many of you can join us, colleagues from, India, Nigeria, Latin America, North America, Europe. We're just so pleased you can take part in this growing movement. The Alliance is about bringing together leaders, practitioners, policymakers, and communities. I mean, we're all united here in building a better world, and we have to take that shared responsibility. Today, that vision is thriving. I mean, we started in Italy earlier this year. We launched social prescribing for the first time in Bologna. You'll hear from Maurizio Marini later today. He'll give you a great insight into what we have planned right across Italy. We're engaging with universities, sporting clubs. We're looking to host a massive festival next year, and it's super exciting. Then if we roll forward, I just want to make sort of an announcement today. We're going to partner with the World Wellness Weekend. It's a huge global initiative that's been started well over 7 or 8 years ago. It's active in 150 countries. And I just want to thank my good friend, John J. de Gabrick, for his leadership, and encourage everyone to go and look at the World Wellness Map and to take part and get involved. That takes part later in September this year. The Global Social Prescribing Network, and it started, just with a small sort of thought process, but now it's spanning over 30 countries. I mean, there's over 45 countries taking part in this event today. It's phenomenal. If you need to access any of our tools, do go online, go to our webpage, www.wis.org/GSPA, and you can download, some of the tools, the playbook. We're developing new training tools. We're developing the digital infrastructure, and we really want to scale social prescribing. Earlier this month, we've launched our Social Prescribing Unlocking Industry Opportunities initiative. We've got events coming up because what we want to try and showcase with investors is that well-being is not only good for the community and people, but it makes economic sense. This complements as well. We just launched our training and development roadmap for link workers. We want to empower the next generation, the global workforce, and ensure they have the skills to deliver at scale. So if you're listening to this, you're an academic institution or government who want to reach out, and if we can help, just contact myself or James or any of the team. Over the past 5 years, we've really worked hard to build a network I've spent a lot of time flying around the world. I've been to UNGA, I've been to the World Economic Forum, I've been to, countries in the Middle East, I've been all over the world. In Indonesia, for example, I've been presenting the alliance, the work that we've been doing. And I've done many weekends where I've spent at the weekend, engaging with students. And it's so vital that we adopt social prescribing on a global scale. It gives us an enormous opportunity to work with primary care, hospital sector, and engage large-scale communities across the patch. And the case for change is just dramatic. I mean, it's a situation. It's urgent. In the UK, we have about 2.5 million people with ill health at the moment, costing the UK economy 100 billion annually. We've 7 million people waiting on waiting lists. We've 700,000 women who can't get gynecology services. We just have enormous challenges, and this is replicated not just in the UK, but in Europe, in the US, and across the world in lower middle income countries. Don't also forget that we've over 3 billion people who don't have access to healthcare. We face huge mental health challenges, loneliness, chronic illness, and then, of course, the climate situation. The climate crisis is straining our health systems as well. And the traditional models are just not fit for purpose. We need a paradigm shift. And, I've been talking to colleagues in London this week, and Dr. Sriti Krishnamurthy, one of our ambassadors, she said something to me about public health doesn't begin in hospitals, and she's absolutely right. It begins in our homes, streets, and communities. This was the point she was making, and we must create a space for stories and systems that make prevention personal. Part of the work we're doing with the Social Prescribing Alliance, but also with the World Health Innovation Summit. I mean, this is the platform that we set up to enable these innovative ideas to come to the forefront. Extremely proud of the work of the WIS, because the WIS was one of the catalysts behind the Global Social Prescribing Alliance. And we've such an opportunity here to be able to mobilize communities, mobilize financial capital as well. I mean, social prescribing as well delivers £1 for every £1 invested. You get up to 4 back, in social return. And then we're able to reduce GP visits. We're able to ease some of the pressure on the health system. And most importantly, improving lives. That's what this is all about. So today, as part of this global initiative and part of the summit, we're launching our Global Social Prescribing Impact Awards. We're going to cover a number of excellence categories, and that's innovation, community connector, researcher or research team, student champion, and change maker. The nominations are open until December 4th, and we'll announce the winners at next year's conference online. So if you're out there listening to this, get involved, go to the webpage and join us. And if you know someone who's doing inspiring work in social prescribing, make sure you put them forward for an impact award for next year. I want to emphasize that today is all about a celebration. It really is about a launch pad. We are gaining enormous traction. As I mentioned, we have over 200 organizations taking part in this event today. I'm truly grateful for the support, and we've over 45 countries, as I said, engaged in this process. So what I want to say is, if you're listening to this and you want to get involved, if you want to become a community champion, a social prescribing champion, if you even want to volunteer, like we have volunteer opportunities as well with the WIS, you're more than welcome to get involved. Look on the website, you'll be able to find all the information. And this is not just for the health sector. This is finance, education, the arts and beyond. Like, we need everyone engaged in this. Your leadership is crucial. Be under no illusions. The health system is under such pressure that we need support from elsewhere. The health systems we need new ways of working, new dynamic thinking. And we can provide that. You, me, and everyone in this group working together. We've launched a initiative to showcase sort of industry and how industry can get involved with social prescribing. It's an enormous opportunity. This sector is growing and growing and growing. Prevention is going to be the future driver of our economies. So if you're interested in this, in digital health, AI, nature, arts, culture, wellness, fitness, sport, most important, finance and investment, workforce or education, join us on the September 12th or November 12th. We're going to be hosting a number of activities. Reach out to me or reach out to go through the website, and you'll be able to find more information. I want to say a special thank you to the University of Lancaster, the Social Prescribing Unit. We've partnered as an academic partner for this event. Look forward to working with them in the future to develop that. There's going to be further training materials available. We're certainly exploring that opportunity with our academic partners around the world, in the US and in the GCC and across the world and Africa. And we're very active in this space. I want to also mention next month, to save the date, we have the second annual event for World Health Innovation Day. This year's theme is all about mental health and well-being, and we encourage people to get involved, just health for all. So just make sure you check that out on our website. We'd very much encourage local communities to get involved in that. And then a couple of weeks later, as I mentioned, we'll start with our industry roundtables. And most importantly, if you're in the financial sector and you're watching this, or you're part of any institutional investor, foundation, philanthropic, or high value net individual, family office, please reach out to us. Where we're looking to engage and mobilize capital to support these projects at a local level. We're doing some very interesting work with a number of colleagues who are speaking here today. You'll hear from them. You'll understand how we're bringing capital to support social prescribing, but also other health innovations that are out there. We're very active in this space, because it's a huge need. We recognize that we have to think differently. And Global Social Prescribing Alliance, World Health Innovation Summit, that gives us those platforms to be able to do that, to mobilize on a global scale. Now, I just want to talk about London, and London sort of plays a critical role in this. Later in the year, 7th of November, we plan to launch WIS in London, and Global Social Prescribing Alliance will take part in all these activities as well. London is the financial capital of the world. Like, we need to channel that investment into community-led health solutions. And what I want to encourage people, as I said before, if you're involved in development financing, investors, governments, come and partner with us. We are speaking to a lot of countries across the EU. I've been engaging with a number of colleagues in the Nordic region, across the EU, in the US, Latin America, Africa, GCC. We're engaging heavily with GCC countries now at the moment. We want to bring a new model of healthcare, which is based on prevention. It's a huge opportunity, huge economic opportunity to improve people's health and well-being, but also to drive economic growth. And then one other thing that I want to say is we're super excited as well. We're launching our wellbeing retreats. This is with Dr. Melissa Sundram and myself. Our first event will be in Finland. Also in early January, I'll be in Helsinki with the Radical Health Festival again. Delighted to be back there, but this time we'll be taking a delegation. If you're a business delegation, you want to get involved, you want to come and meet with Ministry of Health and colleagues at the Radical Health Festival, reach out. We plan to bring a UK delegation across. What we want to try and do is get a number of these events and activities going together, so we can encourage industry and business and trade to flow between bilateral nations, and see how the value proposition stacks up behind social prescribing. I also want to say that we've had a number of supportive messages that's come in, and I'm grateful for that. Make sure you check out our keynote today at 4:30 from our strategic partners. Dr. Dennis Oswald's keynote will demonstrate why investing in well-being isn't just ethically right, but it makes economical sense. Throughout the day, you're going to see some fantastic speakers. You're going to hear from leaders. You're going to hear from the change makers, the people that are on the ground doing the job. Really engage with the session today. If you have any questions, pop them in the chat and we'll try and get to them. We'll try and raise that with the panels. Make sure you check out, the first panel is about access and equity in social prescribing. The second panel will be talking about building social prescribing networks. The third panel will all be about real world impact. It's a sit down, it's a fireside chat. And then, fourth panel is all about technology's role in social prescribing. And then we'll also be talking about clinical integration of social prescribing. And then, as I mentioned, the final keynote will be about policies for a sustainable future. Look, as we begin this summit, I just want to invite everyone to get involved and take part in this movement. If you're sitting there, if you're a policymaker, a practitioner, a researcher, student, community leader, you are part of this solution. We have to do this together. we have to move our healthcare system from working in a silo to working towards a collaborative model. We have to break the isolation. We need to, move from ill care to well-being, from treatment to prevention and empowerment. Like, also, let's be bold, let's be ambitious, let's be united here. Let's build a healthier, more connected world. Let's work together. Healthcare can bring that together, and only by working together can we achieve these long-term goals. I just want to thank everyone for being here. And then finally, I'm absolutely delighted that we'll be back next year. We have a date. It'll be live on our website pretty soon. Global Social Prescribing Summit 2026 will take place online on the 17th of July 2026. So you're very welcome to join. Get registering. We have had over, as I mentioned, 200 organizations, 220 plus organizations, and more than 45 countries involved. Anyone that's interested to join us for next year's event, any sponsors out there, drop me a DM or also pop me an email, because we're open and we're looking forward to working with partners who share our vision and want to scale prevention and well-being globally. Now, it's my great pleasure to introduce you to my friend and colleague, the chairman of the Global Social Prescribing Alliance, James Sanderson, who will share his insights on the future of social prescribing in global health. And I really hope you enjoy the rest of the session.
Hello, and a very good morning to everybody. It's absolutely amazing to join you all this morning, and thank you so much for everybody that's made the effort to join us here to share in this amazing day where we're going to be talking about social prescribing and the opportunity that it has to transform global health. I wanted to just share a few words with you about why I think social prescribing is important and why today's event is incredibly important for the movement that is transforming world health. Well, firstly, all of the amazing people that have come together today from right across the world. As Gareth mentions, we've got over 45 countries that have joined today, and over 250 organizations. And I think what is absolutely amazing is that we all share a collective vision that is essentially about helping the world become better. And for me, social prescribing isn't just an intervention or a program. It is about a movement for change. It's about a movement of like-minded people who want to improve health and well-being, who want to tackle the barriers that people face to good health, who want to tackle inequalities in society and bring communities together in order to revolutionize the outcomes that people so desire. And I think, that is a truly amazing mission for us all to share and for us all to contribute to. The Global Social Prescribing Alliance isn't about egos or hierarchies. It's about bringing people together from all sorts of places, from government ministers through to practitioners working in communities on the ground, and everybody in between. It's about clinicians, it's about community workers, it's about people working in various organizations, in businesses, who all share this view. And when Gareth and I came together in 2021, and the Global Social Prescribing Alliance was launched by the then Secretary of State for Health and Social Care in the UK, we basically wanted to enable people to come together to share their knowledge and experience, and to hopefully try and push health systems across the world to consider new ways of operating, because we saw that the health challenges that the world faced were fairly universal, and we saw that there was an opportunity to bring about greater change by working in unity. So what amazing group of people that we've got assembled. And why is social prescribing important for us all then? Those of us that have come together today, and all of the people that are working so hard across the world. Well, I think everybody will recognize, and Gareth said in his introductory speech, that we have a significant global challenge across all sorts of aspects of health. We have some huge divides in regard to demographics. So the outcomes around ethnicity and wealth create some really, really alarming barriers in society. In the UK alone, there's a 10 to 15 year gap in life expectancy between those in the poorest areas and those in the most affluent areas. And we see lots of challenges around people's ethnicity as well, in terms of the outcomes and the access to services that they can gain. We also have issues across the world with the limitations of medication. Now, medicines will always be important, and obviously we owe our extended life to a lot of advancements in medicines over the last 100 years. Antibiotics, for example, the opportunities of vaccination have created some huge transformations in world health. But we also know that there are limitations. We have problems with addiction to opiates. We have issues of antimicrobial resistance as well now, that's creating challenges in health services across the world. We've also not really addressed the opportunity of extended life. So in the UK and in a number of developed health economies across the world, life expectancy over the last 80 odd years has changed quite dramatically, from about 65 years to 82 years. We're living 17 years longer than we were 100 years ago. And actually, if you look at how life expectancy has changed over the last 600 years or so, life expectancy was around 42 years for many hundreds of years. So this sharp increase in life expectancy that we've got is obviously something to be hugely celebrated. We're not dying anymore of some of the things that created limitations to our life expectancy many years ago. We're able to treat many cancers. We're able to treat many issues. We're able to replace vital organs. We're able to perform surgery. We've got advancements of technology through MRI imaging and X-ray that are creating all sorts of opportunities for longer health. However, in most developed countries, we're not living necessarily healthier lives. And long-term conditions and multimorbidity, people living with chronic conditions like COPD, type 2 diabetes, heart failure, and dementia are creating issues for how people can get the most out of their lives. And actually, when we look at the ways in which we can tackle this, whilst medicine provides some major answers, it doesn't provide all the answers. And in 2015, here in the UK, I led within the National Health Service a movement to personalised care and support. And within that, we created the opportunity for social prescribing to be scaled as part of a long-term plan for the NHS. And I worked with some fantastic pioneering people at the time, people like Ian Dodge and Bev Taylor and Rich Watts and Jenny Walker and Nicola Kay, who were all pioneers in moving forward the opportunities for social prescribing to thrive across the country. And we scaled it to have over 3,000 link workers, social prescribing link workers, positioned in general practices right across the country. And we were able to support, through our comprehensive model for personalised care, 10 million people with new approaches to health and well-being. The whole idea being to challenge the way in which healthcare and medicine was delivered, to look at how we could support people through psychosocial approaches to health and care, using what we called the 4 pillars of social prescribing. So looking at how arts and culture could influence people's lives and health and well-being, how sport and exercise could create the opportunities for an enhanced health and improvements in various conditions, how knowledge and learning could support people to tackle some challenges in life and learn how to deal with societal challenges like debt and relationships and housing, and finally how the natural environment could help keep us well by spending more time with nature. So those 4 pillars of social prescribing looked at the building blocks of actually how we can provide people with good health and well-being outcomes. And we considered, what are really the building blocks to healthy life. It's about social connection. It's about the opportunity to have activity, to have purpose and meaning in life. And that's what social prescribing does at its heart. It brings people together. It gives them purpose. It gives them an activity. It gives them the opportunity to engage with their health and well-being in a different way. and that shifts mindsets and shifts people to be able to achieve the outcomes that they want to achieve. So I think that social prescribing is still, even after the last 10 years of me being involved in its development and its scaling, I think it still represents an amazing opportunity to revolutionize health and well-being right across the globe. And if we come together with opportunities to work across health and well-being, opportunities to work across communities, I think the people on this call, the people joining us at the Global Social Prescribing Alliance, joining our movement, can make a truly huge impact in world health. I wanted to leave you with a few tips before I finish, and this is based on all the work that we led in the NHS and the work that we've been doing over the last 10 years. The first thing is be bold. Gareth even mentioned this, and actually, I think this is a movement that requires people to be bold and stand up and really be open about talking about the opportunities that it brings. And that's what we want to do through GSPA, through the Global Social Prescribing Alliance. We want to give everybody a platform, a vehicle to celebrate your successes and to champion the work that you're doing. As I said before, this is not about egos. This is not about hierarchies. This is about people coming together with a bold vision. The second tip is try not to overcomplicate things. I've seen a lot of opportunities really go the wrong way, where people try and bring an overly academic approach to social prescribing, where people try and overcomplicate the model, create all sorts of structures that overlay what is quite a simplistic opportunity, and that really stifles the creativity, and it really takes away from the opportunity to find real change. So really try not to overcomplicate it. The third thing is about the fact that social prescribing has to work in concert with other things. Within the NHS, we talked about the fact that it worked, complementary alongside things like what matters to you conversations, personalized care and support planning, health coaching, bringing people together with new ways of organizing money and resources. Social prescribing on its own is really powerful, but in concert with other things, with other movements, with other community approaches, it can make a really huge difference. And finally, I just wanted to say to you all that this is also about trust and unity and working together. If we continue this focus of bringing people together, of accepting that everybody, wherever you are in the world, whatever work that you're doing, has got a huge contribution to make. Doesn't matter how senior you are in an organization. It doesn't matter about the resources that you've got. The contribution that you make to this movement is just as valid. So please value yourselves, value the contribution that you're making. Look at being bold. Don't overcomplicate it. Work in concert with other things, and I think together we can truly transform people's opportunities for gaining good health and well-being. And that is a mission that I've been passionate about for the last 10 years. And it's a mission that I'm going to continue to lead and support from the Global Social Prescribing Alliance. I wanted to just use my last minute that I have left to just pay tribute to Gareth Presh for all the amazing work that he's done over a huge period of time. I've been working with Gareth now for over 5 years, and Gareth has made a huge amount of personal sacrifice and put a huge amount of personal effort into global social prescribing. He has, as he said, spent many hours trekking the world, many hours in airports, on trains, on planes, talking to people about the opportunities that social prescribing brings. And I think we have a truly inspiring leader in Gareth that as I say, through personal sacrifice has really put other people's health and well-being and the opportunity to transform global health before, sometimes before his own health and well-being. So we all owe a lot of thanks to Gareth. And I just wanted to pay tribute at this summit for all the work that he's done. I will now hand back to him, and hopefully he's suitably embarrassed by that tribute. And I look forward to seeing everybody else and hearing from everybody else during the course of the day. Thank you very much.
Thanks, James. I am extremely embarrassed after that, but I appreciate it. I'm very grateful for the support. And so everyone who's watching, just take 10 minutes, have a break. We'll be back in 10 minutes with our next session. The first session will be panel 1, access and equity in social prescribing, exploring solutions to reduce barriers and improve inclusivity. So do join us, grab a cup of coffee. We'll be back in 10 minutes live. Okay. Thanks, everyone. We'll end this. Thank you.